Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Family, begin with a careful idea. Do not think of acne as dirty skin. Do not reduce it to chocolate, oil, or teenage hormones. Look deeper. Acne is a disease of the pilosebaceous unit, the small biological neighborhood where the hair follicle, oil gland, skin cells, immune signals, and skin microbes meet. Why does this matter? Because if we misunderstand the battlefield, we choose weak weapons. Acne forms when several forces overlap: excess sebum, abnormal shedding of follicular cells, inflammation, androgen sensitivity, and the activity of Cutibacterium acnes, a normal skin organism that can become involved in inflammatory signaling. Modern dermatology no longer treats acne as a simple infection. It treats it as an inflammatory disorder with microbial, hormonal, nutritional, and barrier-related dimensions. The American Academy of Dermatology describes acne as one of the most common skin conditions in the United States, affecting nearly 50 million Americans yearly, and its guidelines continue to place proven therapies: benzoyl peroxide, topical retinoids, antibiotics when appropriate, hormonal therapy, and isotretinoin at the center of care. Keep that in mind. Nutrition can support the terrain, but it should not replace medical treatment when acne is moderate, cystic, scarring, painful, or emotionally heavy. Now ask the key question: why talk about red meat at all? How could a food so often discussed in heart health debates have anything meaningful to offer the skin? Here is the answer. Red meat, when chosen carefully and used with discipline, can act less like a pimple remedy and more like a concentrated nutritional tool. It provides highly available zinc, complete protein, heme iron, vitamin B12, niacin, selenium, and other cofactors involved in immune balance, tissue repair, energy metabolism, and skin integrity. Do not picture fast food burgers, bacon, hot dogs, or heavily processed meats. Picture lean beef, lamb, or bison. Picture a measured portion. Picture it beside vegetables, olive oil, legumes, or whole food carbohydrates, and water, not soda, fries, and dessert. So listen carefully. The goal is not to say, eat steak and acne disappears. That would be careless. The stronger message is this: if acne is partly driven by inflammation, poor healing, unstable blood sugar, low zinc status, restrictive dieting, or inadequate protein, then lean unprocessed red meat may help correct parts of the internal environment that allow acne to persist. Why? Let us develop it step by step. First, understand the glycemic angle. Tell yourself this: control the insulin spike. Why? Because high glycemic meals, white bread, sugary drinks, candy, sweet cereals, pastries, and large refined carbohydrate loads can increase insulin and insulin-like growth factor signaling. How does that connect to acne? These signals can influence sebum production, follicular cell growth, and androgen-related pathways. Several reviews and dermatology resources report that low glycemic dietary patterns may reduce acne lesion counts or severity in some people, while high glycemic patterns can worsen acne tendency. Now place red meat inside that framework. Red meat contains essentially no carbohydrate. That means it does not directly raise blood glucose the way sweetened drinks, desserts, and refined starches do. How can that help practically? Replace the acne-promoting meal pattern, not just one ingredient. Do this. Instead of a sugary breakfast and snack-driven day, build a plate with lean red meat, greens, lentils or beans if tolerated, avocado or olive oil, and a low glycemic carbohydrate such as intact oats, barley, quinoa, or sweet potato. Why does this matter? Because the benefit may come not only from what red meat adds, but also from what it displaces. Second, focus on zinc. If there is one mineral that deserves attention in acne nutrition, it is zinc. Why? Zinc participates in immune regulation, antioxidant defenses, epithelial repair, wound healing, and inflammatory control. In the skin, zinc is deeply involved in keratinocyte function and tissue recovery. Reviews of zinc and wound healing describe zinc as a cofactor for thousands of proteins and enzymes, with roles in DNA repair, immune function, antioxidant defense, and extracellular matrix regulation. How does this connect to red meat? Meat, fish, and seafood are among the richest and most bioavailable zinc sources. The NIH Office of Dietary Supplements notes that zinc from animal foods is generally more available than zinc from beans, nuts, and whole grains because plant phytates can bind zinc and reduce absorption. Beef also contributes a meaningful share of zinc intake in the United States because it is commonly eaten. Now ask, what happens when a person with acne is also low in zinc or eating a highly restrictive diet? The skin may lose part of its repair capacity. Inflammation may linger, lesions may heal slowly, marks may last longer. A systematic review and meta-analysis on serum zinc and acne reported lower serum zinc levels in people with acne compared with controls and found evidence that zinc treatment can improve inflammatory acne, though study designs and results vary. A review of oral nutraceuticals for acne also identified zinc as the most studied nutraceutical, while reminding us that not every trial shows the same magnitude of benefit. So use zinc intelligently, respect it, but do not exaggerate it. Here is the practical command. If you choose red meat for acne support, choose it as a zinc strategy. Select lean, unprocessed cuts. Keep the portion moderate, often about the size of your palm. Eat it 2 to 4 times weekly if it fits your health status, culture, budget, and medical needs. Do not use it as permission to eat processed meat daily. Do not burn it heavily. Do not bury it under sugar-rich sauces. Let it serve the skin, not sabotage the body. Third, look at protein and wound repair. Ask yourself, what is a pimple after it opens, drains, or inflames? It is not just a blemish, it is a tiny wound in an immune-active organ. How does the body repair wounds? It needs amino acids for collagen formation, immune cell activity, enzyme production, and barrier restoration. Red meat provides complete protein with all essential amino acids. For someone under-eating, dieting aggressively, recovering from illness, training hard, or eating mostly refined carbohydrates, a measured serving of high-quality protein can be a powerful correction. This is where many people miss the connection. They buy stronger cleansers, scrub harder, and add more acids. Stop doing that reflexively. Ask instead, does the skin have the raw materials to repair? Are you eating enough protein? Are you getting zinc? Are you sleeping? Are you supporting the barrier? Acne treatment is not only about killing bacteria, it is about calming an overreactive follicle and helping damaged tissue resolve properly. Fourth, consider iron, B vitamins, and energy metabolism. Why do these matter? Because skin is metabolically active. It renews itself constantly. It depends on oxygen delivery, mitochondrial function, cell division, and immune surveillance. Red meat contains heme iron, the form found in animal foods, along with non-heme iron. Heme iron is generally absorbed more readily than plant iron. The NIH notes that meat, seafood, and poultry contain both heme and non-heme iron, while plant foods contain only non-heme iron. Red meat is also a source of vitamin B12, niacin, vitamin B6, riboflavin, and other nutrients that participate in energy and cellular metabolism. How could that matter for acne? Think of the person who has acne, fatigue, brittle nails, heavy menstrual bleeding, low dietary intake, or a history of restrictive eating. In that person, acne may not be caused by iron or B12 deficiency, but weak nutritional status can make the skin less resilient. So do not ask only, what food triggers my acne? Also ask, what nutrients am I failing to provide? Now add an important caution, because sophisticated advice must include boundaries. Vitamin B12 is essential, but high-dose B12 supplements have been linked to acneiform eruptions in some individuals. A metatranscriptomic study found that B12 supplementation could alter gene expression in Propionibacterium acnes, now called Cutibacterium acnes, and increase porphyrin production, which can promote inflammation. In that study, 1 of 10 supplemented healthy subjects developed acne after supplementation. This does not mean food level B12 from red meat is the same as megadose injections or pills. It means do not megadose blindly. If you need B12 treatment, follow medical guidance. If you break out after high-dose supplements, report it and adjust with your clinician. 5th, understand the microbiome angle. Why does the same food seem to help one person and hurt another? Because acne is not one pathway. The skin microbiome, sebum chemistry, hormones, genetics, stress, sleep, menstrual cycles, medications, cosmetics, and gut patterns all interact. C. Acne is not simply bad bacteria, it can be present on healthy skin too. The problem is strain behavior, follicular environment, inflammatory signaling, and host response. Reviews describe acne as involving androgen-driven sebum, follicular hyperproliferation, inflammation, and microbial interaction, not just microbial overgrowth. So how should you test red meat without fooling yourself? Use a clean method. Do not change 10 things at once. For 4 weeks, keep your skincare stable. Keep your sleep schedule as stable as possible. Replace refined, high glycemic meals with balanced meals that include lean, unprocessed red meat 2 or 3 times per week. Track new inflamed lesions, oiliness, tenderness, digestion, menstrual timing if relevant, and energy. Why 4 weeks? Because acne lesions develop beneath the surface before you see them. Give the follicle time to respond. Use this plate formula: 1 palm of lean red meat, 2 fists of colourful vegetables, 1 thumb of extra virgin olive oil, avocado, or nuts if tolerated, 1 controlled serving of low glycemic carbohydrate if you need it, water or unsweetened tea. Add fermented foods if they agree with you. Add omega-3 rich fish on other days. Keep dairy under observation, especially skim milk, because dairy has a weaker but repeatedly discussed association with acne in parts of the literature. Do not obsess, observe. Now ask, who might benefit most from this approach? Think of people whose acne worsens when they live on cereal, sweet coffee, pastries, snack bars, and takeout. Think of someone with low protein intake, low zinc intake, or very restrictive eating. Think of athletes who sweat heavily and under-recover. Think of someone who eats clean but mainly survives on salads, fruit, and crackers, then wonders why wounds linger and skin looks inflamed. For these people, red meat may be less of a trigger and more of a missing building block. Who should be cautious? If you have high LDL cholesterol, cardiovascular disease, kidney disease, gout, hemochromatosis, inflammatory bowel disease, flares, pregnancy-related dietary restrictions, or a medical plan that limits red meat, consult your clinician. If processed meat worsens your skin, remove it. If high saturated fat meals worsen your acne, choose leaner cuts or another zinc source like oysters, poultry, eggs, legumes prepared to improve mineral absorption, or medically supervised supplementation. Do not force a food that clearly harms you. And remember this, dermatologic treatment still matters. If acne is scarring, deep, nodular, or persistent, book the appointment. Use proven topical therapy correctly. Be patient with retinoids. Use benzoyl peroxide wisely. Do not let nutrition become a reason to delay care. Instead, let nutrition become the quiet foundation that helps treatment work better. So bring the message together. Red meat can be beneficial for acne, not because it is magical, and not because acne has one cause. It can help because lean, unprocessed red meat supplies highly available zinc for immune balance and repair, complete protein for healing, heme iron and B vitamins for cellular function, and a zero sugar, low glycemic anchor that can replace foods more clearly linked with acne flares. Why does this work best when done carefully? Because acne is a conversation between hormones, follicles, sebum, microbes, inflammation, and lifestyle. How do you use red meat well? Choose lean cuts, keep portions moderate, avoid processed forms, pair it with plants, control sugar, track your skin, respect your medical history. Do not chase extremes. Say this to yourself as you leave. Feed the skin like an organ, not like a cosmetic project. Give it structure, give it minerals, give it protein, give it steadier signals. Then combine that foundation with smart dermatologic care. Thank you, family. Stay well, take care of one another, and I'll see you in the next topic.